Two.
Hey folks, I'm here in Paducah, Kentucky with my friend Dr. Matt, and what we are seeing today is blowing my mind. And so your office is quite a bit bigger than our office. You got chiropractic, you have decompression, you have physical therapy, but you have something that's a little different. You have stem cell, you have PRP. Well, what's the difference between stem cell and PRP? Let's just start there, real bare bones. What is that?
So PRP is it's a platelet. Okay, so in your blood you have cells, red blood cells, white blood cells. You have platelets. They don't have a nucleus, so they're not a living tissue really. Okay, they carry growth factors. So think of them like a car that you got in and you came up here. The value of the car on your trip was you, not the car. The stuff in it is the most important thing. So platelets are that way. They carry stuff around. They do lots of things. One of them, obviously, when you cut your skin, they coagulate. They're sticky. They stop it from bleeding. But another thing they do is you have growth factors. So anything they get involved in that's injured, they're going to release growth factors, and those growth factors are what causes collagen to grow. So we use those around ligaments and tendons and things to stabilize joints that are just not stable and becoming arthritic. Now, a stem cell is far different. It's a living cell, has a mitochondria in there. This cell, that's telomeres, it's a living tissue. So we all have stem cells. Mm-hmm. You wouldn't live 4 minutes without stem cells in your body. So your body's always changing this stuff over, and stem cells are there to repair and recover. Those are generally made in the bone marrow. There's two kinds, hematopoietic, mesenchymal stem cells. So hematopoietic stem cells turn into your cells, your red blood cells, your white blood cells, things like that. Mesenchymal cells turn into tissue, heart, liver, skin, lung, cartilage, things like that. So we use those stem cells therapeutically to get them in places that are not able to recover, so they can help that building back that process.
I love it. Well, I was watching Sean, the medical doctor in your office, and he was getting stem cells out of the adipose tissue. And if you don't know what adipose tissue, it's fat.
Yep, fat.
So I have a lot of stem cells, but like, explain that, because I saw him inject stem cells. He extracted it and injected it same day within like an hour.
That's right.
Maybe within 30 minutes of this guy that had terrible knee pain, had a spinal fusion, and they used fluoroscopy, which if you don't know what fluoroscopy is, it's where it's like a video x-ray and he could see exactly where the needle went. But like, explain, because this is all new to me, right?
Absolutely. Yep. So stem cells are in every part of your body, your brain, your heart, liver, lungs. They're just easy to get in the fat. Okay, bone marrow, you'd have to do a tap. After about 40, your mesenchymal stem cells, the volume's not there, so it's not a good source of it. Believe it or not, fat is very vascular and extremely vascular. So some of the stem cells have left your bone marrow and arrived in your fat. But fat is not part of your DNA structure. They cannot identify with it. So the basis on the stem cell, they go places, identify with that tissue, convert into that tissue. They can't do that in the fat. So they're stored there. So we do a little mini liposuction so we can get a lot of volume out of a particular part of your body that's easy to access. Not easy to access your brain or your other parts of the body. So we extract that. About 30 cc's of fat will get us about 500 to 700 million stem cells. Cells that can convert into other tissue. That's what we do.
I like it. So you got a model with you, and I liked how you explained this, because you're actually teaching me a lot today, and I appreciate that. But if you notice, you got older folks that are bending forward, they slunched forward. Well, a lot of that is ligaments and tendons, and over time they wear down.
They get lax.
And I'm gonna let you take over and explain that process and why that happens, if you don't care.
Yeah. So here we got a spine. So this is the front, this is the back. So typically a good spine looks kind of like this. You've got these three curves in it. That's what we all teach our patients. We want these nice, good curves. But these curves are created by ligaments. So here you can see, if you have strong ligaments, those bones are nice and tight. So there's your curve. If these spaces were to separate, you lose your curve. But guess what happens? See the ligament, as it got stretched, there goes your curve. So as we age, you'll never see an old person going that way. It's impossible. They all go this way. And every time they go another degree forward, you're losing, these ligaments are under extreme stress and they're breaking out even faster, okay? So ligaments are what hold us together. They have no blood supply, unlike fat, no blood supply. So therefore, when they're injured, stretched out, they're on their way out. They're on their way out. So this is what we fight against, gravity and ligament damage. So we take platelets and inject them in these ligaments to get these ligaments to tighten back up again and build that. And here's a good example. This is one, you can see, this person bends forward, right back up again. So these ligaments are there to support those curves.
Yeah, it's like the cables of a bridge.
Yeah.
They need to be there.
That's it. Exactly right.
So I want to kind of full circle this with you, Dr. Matt. So I'm seeing a lot, but what kind of conditions do you see? Like, what is your favorite cases? You know, there's a lady that stopped you in the hallway and it was like, I'm getting phenomenal results, but I think it was her nephew, neighbor, sorry. But you know, the gastroparesis, but like kind of walk us through the cases that you see, the miracles that you are seeing in this office.
Man, that's a tough question, but I guess I would have to say that the sicker the person, the more no hope they have to see that come back. I mean, man, it just grips you. Somebody gets out of a walker or wheelchair, that tears you up. So, but just a bad shoulder, a bad spine, I mean, this sets people back in their life. You know, when you fix that and they come back to you, man, it's just life changing. So for us, I mean, we put stem cells where nobody else is fixing that. They're just on drugs and medication. When you fix that, those patients, man, it's just life changing. So I like our neuro cases, Parkinson's, neuropathy. These are really bad cases that are messing families up. They mess up your attitude, your sleeping. I mean, can you imagine what goes on in a family like this? But those cases when they can walk again and they can get off their medications and things like that. Back's no different. I mean, you've seen patients today like, I don't want to live anymore. So when you can fix those,
yeah,
it's just anybody that needs hope. That's my favorite person.
Yeah. Oh yeah. Well, and in school we learn, hey, Parkinson's, MS, peripheral neuropathy, where you can't feel your feet. You can help slow it down, but you can't do nothing about it. But what I'm learning from you today is that you can,
yes,
and there is a better way.
100%.
And you don't have to be on drugs
Right.
for the rest of your life, ruining your life.
That's exactly right.
Well, I'll just full circle, Dr. Matt, you are coming to Salem, Southern Indiana area, and you are putting on a seminar with us, and that will be April 9th and April 10th.
Yes.
And so
do not miss it.
Absolutely.
Bring your friends, tell people, because you know this is about changing somebody's life. If it's not affected now, when it happens to you, it's devastating. So we're really excited. We love to go and do this with partnering with people like you that really care about people.
Yeah. Well, and I can see your heart and I can see your love for people, and you give people your cell phone number. So you can tell me no, right? But is it okay to share with the audience your phone number? Because somebody listening right now is probably dealing with some of these more advanced neurological disorders.
Sure.
And they can just reach out to you and ask you questions. Is that?
Yep, reach out, they can text or whatever, and I'll set up a meeting with them or whatever they want to do. But our office number is 270-554-5114. Best way to get us so we can set a time designated just for you. You need time to listen. My cell phone, 270-519-8127. So better to go through the office so we have plenty of time. You don't catch me, between patients and whatnot. So
Absolutely.
Those are the two ways to get us.
Awesome.
Looking forward to coming back there and seeing you guys.
Thank you.
All right.
Thank you guys.